Did you know women are less likely to pass away and less likely to be readmitted to the hospital if they were treated by a female doctor? Did you also know that people who are operated on by female surgeons are less likely to experience complications and are less likely to need follow-up care than with male surgeons? Male physicians often underestimate symptom severity, not take female patients seriously, incorrectly diagnose women's symptoms as anxiety, periods, or their weight. Female physicians communicate more effectively, taking much more time to listen to their patients. Doctors in Canada and Sweden reviewed more than 1 million patient records and found that patients seen by female surgeons had significantly better outcomes with fewer problems in the months after the operation. Why? Records suggest that female surgeons tend to operate more slowly and may achieve better results by taking their time in the operating theater. When the doctors looked at deaths post-surgery, the difference was even starker. Patients treated by male surgeons were 25% more likely to die 1 year after surgery than those treated by female surgeons. Listen to this person's experience that proves this even more. A male doctor I had 10 years ago dismissed me when I came in and said I had been having lower abdomen ache pains for some time, and I noticed I was spotting from time to time. I had also noticed weight gain when I hadn't changed my diet and ate pretty healthy. His response was that I probably wasn't cleaning myself properly and the blood I was seeing when I wiped was old blood from my last period. He also called me borderline obese. He did not call it overweight. He said obese. I needed to lose some weight. I'm 5'5" and went from 140 to 165 after the unexpected weight gain happened. That's classified as overweight, not obese. I told him that I eat a lot of veggies, chicken, don't drink a lot of alcohol, that I shower twice a day, so I don't think this is all normal. He completely dismissed me. A few weeks later, I ended up having to go to the ER due to the constant and severe pain I was experiencing. Turns out I had ovarian cysts and one had burst. The doctors in the who saw me were appalled when I told them how my general practitioner had dismissed me. A simple ultrasound would have shown the cysts and my GP could have then diagnosed me properly, but he didn't. I then had a $2,000 hospital bill, and it most likely could have been avoided if my GP had listened to me. Instead, he just accused me of being fat, lazy, an unclean person, and needed to change my habits. When in reality, I'm super clean, take care of myself, and was experiencing all of these symptoms due to these ovarian cysts. Crazy. I hear stories like this from women all the time about their experiences with male doctors. Here's another unfortunate situation with how men in medicine treat their female patients. Lionel Gedge, a dentist who mutilated nearly 350 of his patients. Jacobus van Nierop, nicknamed the horror dentist by French media. He destroyed the mouths of patients over a 3-year period. Sylviane Bolestex, a 66-year-old widow, was one of scores of victims of Jacobus van Nierop. He had wrenched 8 front teeth from her mouth and replaced them with aisle-fitting dentures. Then, as blood was still flowing from her raw gums, he went for lunch. Nathan Sutherland, a nurse at the Hacienda Healthcare, essayed and impregnated a woman in a 14-year coma. Take into account that these are just the men who were caught. Imagine the women in comas or under anesthesia who didn't get pregnant from the other incidents with the same perpetrators. Just think about how many women are victims of male doctors, surgeons, or nurses but just don't know it. I made a short video showing more men in the medical field doing terrible things to their patients. This is why I advise women to only seek out female doctors, dentists, gynecologists, and so on. Another reason I think female doctors do so much better is simply because they're smarter. Studies, which I'll link in the description, shows that women have more active brains than men. There's a massive difference between the female brain and the male brain. People have searched for sex differences in human brains since at least the 19th century, when scientist Samuel George Morton poured seeds and lead shot into human skulls to measure their volumes. Gustave Le Bon found men's brains are usually larger than women's, which prompted male scientists to argue this size difference makes men smarter, but someone else pointed out, by this criterion, elephants and whales should be smarter than people. According to new research, women's brains are significantly more active in many more regions than men's. Women also have an increased capacity to process information. This study by scientists from Amen Clinics in California is the biggest brain imaging survey to date. It compared over 46,000 brain scans from 9 clinics and analyzed the differences between male and female brains. The study found that women's brains were significantly more active in many more areas than men's, especially in the prefrontal cortex, which is involved in focus, impulse control, and the limbic or emotional areas of the brain responsible for mood and anxiety. The researchers used brain scans from 119 healthy volunteers and 26,683 patients. They found that women had greater blood flow in the prefrontal cortex compared to men, which may help to explain why women tend to be stronger in the areas of empathy, intuition, collaboration, self-control, and showing appropriate concern. This also shows that women make better leaders along with better doctors, scientists, and overall better problem solvers. It also revealed increased blood flow in limbic areas of the brains of women, which may also partially explain why women are more prone to anxiety, depression, insomnia, and eating disorders. A woman, Marilyn Vos Savant, has the highest intelligence quotient ever recorded in the Guinness Book of Records, 228, miles away from Albert Einstein and Stephen Hawking's IQ, which was 160. Dr. Green made history in 2014 when she developed a revolutionary cancer treatment that uses lasers and nanotechnology to eliminate cancer in mice after only one 10-minute treatment in just 15 days with no observable side effect. No chemo, no radiation, no surgery. It is a game changer for solid tumors. Badhara Perez Sanchez finished elementary school at 5 and high school at 6. She taught herself algebra and the periodic table. Her IQ is 162, now higher than both Einstein and Hawkins. Currently, she's promoting space exploration and mathematics to young students with the Mexican Space Agency. The 11-year-old has earned a degree in systems engineering from Stanford University and another in industrial engineering with a specialization in mathematics from the Technological University of Mexico. Rory Hugh, the 7th grader who discovered a way to reverse the detrimental effects that pesticides have on honeybees. Without bees, our global food supply is at serious risk. She created artificial flour saturated with caffeine and a food supplement called T-polyphenol. Her experiment worked. The compounds used improved the bees' memories and they began to thrive. Almost 60% of vets are women and over 87% of current vet students are women. Women are set to overtake men in clinic ownership in the next decade. 100% of women that are in medicine got accepted and got hired post-grad. Even in fields where women are the majority, they are still vastly underrepresented in procedural specialties. All of this is one of the many reasons why we need more diversity and more women in medicine. It's not just about hiring women just because of their gender, as you've seen. Women are more qualified, and it's literally better for the patients. The same way it would be beneficial to have more lesbian doctors because they know more ways to help patients who aren't straight that require help heterosexual doctors may not properly understand. Despite women in medicine being so smart and incredible at their job, despite all that brilliance displayed by women and female students, they face so much discrimination from childhood to medical school, even when they finally start practicing. In the past 5 years, nearly 1 in 3 female surgeons within the ANH have experienced sexual assault, marking a sobering revelation that's been described as the Me Too movement for surgery. A study by the British Journal of Surgery reported 11 instances of S among participating surgeons. What's even more shocking, almost 90% of women admitted to witnessing sexual misconduct within the past 5 years. The report's bleak conclusion is that sexual misconduct occurs frequently within the surgical environment, going largely unchecked. The reasons behind this alarming allegation are attributed to the deep misogynistic hierarchies and gender and power imbalances within the field, a disappointing truth that has ultimately created an unsafe working environment for both female staff and patients. Women in medicine are more likely to be passed up for leadership opportunities and awards. Female physicians have the highest rate of burnout amongst all healthcare workers, and yet they still experience gender pay gap.
Bestie, I'm afraid to tell you this, but women in medicine make less than men. This is a fact, we know this, but it's even worse than you think. According to the Doximity 2020 Physician Compensation Report, there are, no medical specialties in which women earned the same or more than men. If you're thinking, well, women work less anyways, they always leave early to pick up their kids from daycare. Or if you're thinking, well, most women physicians are younger rather than older, so they just have less experience, that's why they're paid less. This study already controlled for work hours and years of experience. Behold, the specialties with the largest wage gaps between men and women. Very interesting to see OBGYN right here. And here are the specialties with the smallest wage gaps, but remember, there were no specialties in which women made even the same as men.
Kate Zernike's book, The Exceptions. Nancy Hopkins, MIT, and the Fight for Women in Science revealed how top institutions discriminated against and held back female faculty. 16 female scientists at MIT, led by Nancy Hopkins, exposed and fought against systemic discrimination and biases that marginalized women in science and academia, ultimately leading to MIT's historic admission of discrimination. The president of MIT, Charles M. Vest, admitted to it. Men always accuse women in medicine as being DEI hires, but it's the complete opposite. Women and girls have to work 10 times harder because of how much they're held back.
So this girl was devastated to be told one day that she had failed her exam to get into medical school, but something just didn't seem right. You see, she had studied her butt off and actually felt she had done really well after the exam. Since she was pretty confident she had passed, she just couldn't have been happier. Becoming a doctor had been her dream ever since she was a little girl, and she finally felt this dream was starting to come true. That is until she was suddenly told that despite everything, she had still somehow failed. Because of this girl eventually had to give up on her dream for good. But little did she know, she actually hadn't failed at all. You see, many years after she had gotten rejected from Tokyo Medical University, it was accidentally discovered that they'd actually been intentionally preventing women from becoming doctors for more than a decade. Despite being one of Japan's most prestigious medical schools, they'd apparently been secretly lowering the exam scores of their female applicants due to concerns that they would quit after having children. Up to 20 out of 80 points would be deducted for no reason. And even guys who had already failed the exam thrice would be accepted over girls who had passed the first time. This university later apologized and awarded a small group of women around $4,000 each in a lawsuit. And today, Japanese medical schools are finally seeing more than 40% women for the first time ever.
Parents save more money for their sons to go to college than their daughters. This is one of many reasons that college-bound females, often teenage girls, have to take on student debt to pay for undergraduate degrees at much higher rates than college-bound boys. They take on loans more frequently and they take on more debt dollars. Second, when it comes to household chores, parents pay their sons more allowance than they pay their daughters. And this is despite the fact that daughters do more chores. What's the disparity? Sons are paid twice as much as daughters, according to an analysis of 10,000 families. This happens for a few reasons. Girls get paid less for the same work, girls' contributions to the home are implied, and boys get paid for their own personal care, like brushing their teeth, while girls do not get paid to brush their own teeth. We already know that women are stuck running up Kate Bush's hill to get to the same finish line as men. Economic discrimination may be happening earlier than we had even imagined.
And people wonder why so many women don't want to work in STEM fields. The more you know.